The swine flu is back, and not only is it making people sick, but it is causing several deaths. 3 H1N1 related deaths have been confirmed in Washington County within the past 2 weeks, all under the age of 65. Medical experts are theorizing that older people received immunity from when the H1N1 strain dominated in 2009. So people in their 20s now did not have the same exposure to it, and that's where we're running into problems. Joining me now with some ideas on how to fight the flu and to explain this whole H1N1 is Dr. Jason Church from the Ogden Clinic. Dr. Church, thanks so much for coming today. First of all, H1N1, what is it?
Well, it's one of the influenza viruses, the one that we heard about in 2009. That was pandemic at that time. The difference with H1N1 is it causes a lot of disease in younger population.
Okay.
In that 25 to 40-year-old range, as well as children especially. And that's where it's sort of, what we're seeing with hospitalizations right now is the majority are in that 25 to 40-year-old range.
Now, if you are at home and you feel like you have the flu, is there a sign that says, okay, this might be more serious than just the regular run-of-the-mill flu issue?
Yeah. The difference with the flu is you do have the sore throat, and the fever is quite a bit higher sometimes than you'll get with a common cold. In the 102 to 103 range, even up to 104. You feel a lot more run down than you do with the normal cold.
Okay.
The cough initially is a lot deeper than you get with a common cold.
So at what point do you need to go see the doctor? I know everybody really battles with that. It's like, okay, am I really that bad? Am I just being dramatic? What's that point where it's like, you need to go get some help? Well,
first, we needed to see the doctor, a few months ago, right, and be vaccinated, and that was the most important thing to prevent getting the flu. In terms of going to see the doctor now, when you're sick, not everyone needs to see the doctor. Those who have underlying health conditions, infants under a year of age, anyone who is at risk for dehydration or becoming significantly ill because of underlying diseases like asthma, diabetes, COPD, things like that.
Okay, and then you talked about the vaccine. Is it too late to get vaccinated now?
Not too late. Even if you've had the H1N1 flu this year, it's not too late. You should still get the vaccine. The reason being there are other strains of the influenza virus in the vaccine, and we will have other outbreaks of those viruses later on this season.
And they say it takes a little while to go into effect, but it's still worth doing.
Correct.
Okay.
Definitely still get it.
Glenn and I got ours, and I gotta be honest, I'm feeling pretty great. So we've talked about the treatment, we've talked about the prevention, but let's talk about trying not to spread. We had this awesome story yesterday about, don't give hugs, don't give handshakes, like let's do fist bumps or high fives, because we shouldn't be sharing germs right now.
Right. So hand washing is a big one. Proper cough etiquette, making sure that you're coughing into the crook of your elbow. For those who do have an influenza-like illness, fever, cough, body aches, you want to stay away from them about a 6-foot range, outside 6 feet. Because large respiratory droplets are the main spread mode of transmission. And so anyone in the household that has an influenza-like illness, whether it's been diagnosed or not, they should be wearing a mask if you really want to.
And I like that, 6 feet. That's the rule.
Right.
Stay 6 feet away. Hey, Dr. Church, we so appreciate you coming this morning. Ogden Clinic, all the information right there on your screen for them. We can also put that for you on our Facebook page. He's at the Pleasant View office there, North Ogden.
Yes.
You want to go visit him. So thank you very much for answering our questions.
We'll
send things over to Glenn.
Okay, Emily, thank you very much.